In 2021, there were a total of 145 COVID-19 related fatalities. A majority, or 127, occurred during the island's third surge of COVID-19, which occurred between July 8th and December 31st, 2021. Of that number, 49 were dead on arrival. The investigation found that a majority of all the COVID-19 related deaths in 2021 skewed toward males and the island's elderly populations. CDC epidemiologist Dr. Scott Laney.
Our key takeaway findings is that 80% of the DOAs were unvaccinated. In addition, 63% were over 60 years of age and 63% male. So the unvaccinated issue is very, very important with regards to the DOAs. Health and other disparities were observed among the DOAs as well, including diabetes, chronic renal disease, and cardiovascular disease rates that were elevated compared to the prevalence in the population.
Other findings of the investigation determined that nearly all the DOAs were associated with a Delta surge. Over one-fourth had an education level less than the 12th grade. 67% of COVID-related fatalities in 2021 had a combined household income of less than $35,000 a year. 22% had a household income of less than $10,000, and almost 24% did not have health insurance. While the study has been completed, the CDC and Public Health continue investigating current trends. In the past 2 days alone, there have been 8 dead on arrivals to local hospitals. Territorial epidemiologist Dr. Ann Pobutsky.
Most of them have occurred in the past 3 weeks. There's been 21 deaths in January 2022, of which 13, or 2/3 almost, were dead on arrivals. So we are seeing this surge during what we believe is Omicron, and we're seeing something similar where we're seeing elderly people.
Of the DOAs this year, 9 were fully vaccinated, 4 of whom were boosted. Lead epidemiologist for State Epidemiological Outcomes Work Group, Dr. Annette David, urges residents to stay vigilant against the virus.
We want folks to seek care early to avoid hospitalization. So if you have symptoms and you're at high risk, get tested. If you test positive, make sure you speak to a physician to see if you qualify for the antivirals or the monoclonal antibodies. And the point is to try and do everything that we can early to avoid hospitalization, to protect you before you even need to be at the hospital.
Daniel Perez reporting for Guam's News Network.